We're live.
Okay, thanks for showing up again tonight. Thanks for tuning in online. I really do appreciate all the people that come in and say, hey, watch me online, and then they have questions, and they're always great questions. And actually this last week, I had one of my chiropractic buddies, and Jen, if you're watching, thank you. He tuned in, and he was watching a presentation, and he's going to start doing Monday night health talks, and he sent me one of his, and I was able to watch it, and it was awesome. So I appreciate that. We're back to the basics tonight, so we'll kick it off. Oh, okay. So when we talk about health, the first question that I ask is if you had the opportunity to achieve an optimal level of health and well-being, would you do that? And usually 100% of the people that we talk to say, yeah, I want to be as healthy as we can be. And then the next question is, what is health? Okay, so we look at those two dictionary definitions. Dorland's Medical Dictionaries defines health as a state of mental, physical, and spiritual well-being or normal function. And then Webster's defines health as a state of normal function of all the parts of the body, okay? So when we look at those two definitions together, okay, there are similarities, and those similarities, two words, normal function, all right? So in short, our health is a result of our body functioning the way it's supposed to. It's normal function. So optimal health equals optimal function, meaning again, our body functioning at its best. So who knows better than our body what normal is for our body, right? Nobody. I like to address sometimes what is normal and what is average, okay? Because those aren't necessarily the same thing. We've been getting, I talked about this, that we'll see patterns, like all of a sudden these things start showing up in the office. And it's like they're showing up to slap you in the face and make you study and make you work to try and figure these things out. And once you figure it out, you can help a bunch of people, and then they refer a bunch of people that have the same thing. So we've had a good number of people with thyroid issues come in the last couple months. And thyroid issues can cause a variety of secondary issues. Usually that chemical imbalance of the thyroid can cause migraines. And I would say probably 80% of the migraines that we see in the office are related to the thyroid, slight thyroid imbalance. And then of course, thyroid, it runs our metabolism and our energy levels. So people have a tough time losing weight. That can be a thyroid issue. Constipation, things like that. That can be a hair loss. That can be a thyroid issue. And again, probably over 80% of the people that we see who have a fibromyalgia diagnosis have thyroid issues. So we've been trying to figure out these thyroid issues, and what we noticed is people go in and they get their thyroid levels tested, and they come back and they say, well, the test says it's normal. And I look at the range of these thyroid tests, and it's huge, okay? So you could be high or low for you, and really only your body would be telling you, okay, you're high or you're low for you, and still be within the normal range. But again, that's not necessarily normal, it's just the average, okay? The average is anywhere between here and here, which means you could be here or here and still be high or low for you, okay? So your body, really, we're depending on your body to tell us what is and isn't normal for your body. And how it does that usually is by symptoms, okay? So, we don't like to equate health with a lack of symptoms, right? But obviously if you have symptoms, that's a sign that says, maybe you should investigate to find the cause of those symptoms. But what we've been taught to do a lot of times is just cover up that symptom, and then, you think if we get those numbers into the normal range or the average range, or we get those symptoms taken care of, our body's going to function the way it's supposed to. So I want to look at this a little differently tonight. When we look at some of these symptoms, we'll see they're actually not dysfunctions, they're actual functions of a normal, healthy body. And if we do, take a drug to cover up those symptoms, a lot of times what we're doing is we're dulling our normal function. We're going 180 degrees the opposite direction of what normal function is, okay? So when you look at all of these symptoms on this list, runny nose, vomiting, sneezing, nausea, diarrhea, cough, most of these are going to fall within the category of a first line of defense, right? If you're getting exposed to a bug, for example, or some pollen that's in the air, or you're exposed to a virus in some food, things like runny nose, vomiting, diarrhea, cough, those things are all, there's a mechanism in your body that's going to recognize when there's something in your body that isn't supposed to be there, okay? And if it comes in through an airway, well, a runny nose, that's your body saying, okay, there's something coming in through the airways that isn't supposed to be here. Increase that mucus secretion, because that's going to trap those particulate or virus or whatever it is. And then it's going to run down past the tonsils. And if you check out our immune system talk, you know what the tonsils do? It has immune purpose, their function, and it will actually catalog those proteins from that virus or if it's a pollen or whatever, and then it'll use that later if you get exposed to it to respond quickly. Okay, so it's one of those first lines of defense. Sneezing, again, when you get something in those nasal cavities or airways, that increase in mucus secretion traps it, but then the sneezing gets rid of it. And if it gets all the way down into your lungs, then we're looking at a cough. Okay, so that cough, again, if we're coughing up a bunch of stuff from our lungs, and I always use the example of, like, my mom used to work in a factory, and it was always dusty in there, so she always kind of had that nagging cough. And you go to the doctor, and the doctor says, are there any, other concerns after a normal, checkup? If you say, yeah, I got this nagging cough, what they're going to say is, okay, well, we're going to give you a prescription for a cough suppressant. The cough is gone now. But now that stuff that's constantly getting into the airways isn't getting taken out. And we end up with a situation where now bacteria that are clinging onto those dust particles are down in those deep recesses of the lung, and they're not getting expectorated, which is the things that were coughed out and spit out. So we end up with pneumonia. And then the next step is, okay, now you're on some real drugs, you're on some antibiotics or something like that, where, again, normal function in a healthy individual, they have that mechanism that they can identify that there's something coming into the body that isn't supposed to be there, and then we have a mechanism to deal with that, and that's that cough or that sneeze. If it gets in through the digestive tract, okay, if it's in the upper part of the digestive tract, in the stomach, then we got the vomiting, right? That's going to, again, if you're ingesting something that's poison, your body can recognize that's a poison. If it's functioning normal, okay, it'll recognize it, it'll get rid of it. Out the other end, it makes it down a little further, okay? So, the one that, when we look at this list, the one that I think is most scary to most people, though, you can handle runny nose, vomiting, diarrhea, all those things, cough, but it's that fever that we've really been, trained to be wary of. And so I'm not going to say let a fever run up to 120 degrees and don't do anything about it, because if we get a real high spiking fever that shoots up real high real fast, that can be a medical emergency. But I want you to again be thinking in terms of function, does a fever have a function in your body? Yeah. What does it do? It burns off, literally burns off viruses and bacteria, okay, because they're very temperature specific, meaning if you usually raise that temperature up a degree or two, it's going to kill them. And then what happens to the fever? It breaks and comes back down to a nice, normal, comfy level again. So a fever is, again, like one of those first line standpoint of normal function. If that person is functioning at their normal, they get exposed to a bug, they spike a fever, okay? If we let that go, and they found 90% of those fevers will break, will kill that bug, and then the fever comes back down within 24 hours, and 99% of those fevers would be able to do that, kill that bug, and come back down within 48 hours. Which left 1%, in that case, those 1% needed intervention, okay? Thank God you're that, I want to go back and think in terms of function. That person is functioning at their normal. They get exposed to a bug. They spike that fever, but now we give them the Tylenol. We bring that fever back down. It's comfy for me, but also for the bug, okay? Did I just increase their function by taking away that fever? Did I decrease their function? I just decreased it. I went 180 degrees the opposite direction of what their normal function was in that instance, okay? The body is supposed to be able to identify those things and then deal with them, adapt. If you take away that ability to adapt, we're going the opposite direction of their normal function. So that's why when we spike a fever and we bring it back down artificially, after 4 hours, it's going to try and get back up there, and we're going to have to take another Tylenol to keep it down at that level. And that little roller coaster goes on for 3 to 4 days, which again, if you tune into the immune system talk, 3 to 4 days is how long it takes for the body to generate those immune cells and get them to that infection site and then kill those bugs and deal with that infection, okay? So 99% of the time, we're probably going to be better off and successful more quickly if we did nothing with it and just let our body deal with it, okay? That can be scary, right? So, when talking about function, we always want to talk about what controls all those functions. So when I say the body should be able to identify that issue, and I say the body should be able to adapt and get rid of those bugs or expectorate that mucus, what controls all those functions? Okay, we got estimated how many trillion, 50 trillion cells in the human body, the adult body, and all those cells have different functions and they're all coordinated. Otherwise, if they weren't, we'd be a puddle on the floor. So something is coordinating all those different cells and those different tissues and organs and systems. And what is it that controls and coordinates all those different functions? It's the organ under your head, right? It's your brain, the nervous system. So the nervous system is made up, the central nervous system, of course, is the brain and then the spinal cord. And those messages get sent from the brain down the spinal cord and then out those nerves to all the different parts of the body. So you got nerves that carry messages out to your heart to tell it how to beat, when to beat, how fast to beat, how hard to beat, all those things. You got nerves that carry messages out to your lungs to tell them when to breathe, how hard to breathe, when to cough, all those things. Your stomach, your liver, your spleen, pancreas, every part of the body that functions because there's a nerve that carries a message for that event to happen. It's not by accident or by chance, okay? And if that system is coordinated and it's functioning the way it's supposed to and communicating the way it's supposed to, that's what we're talking about. That's being able to identify, okay? We're using the nervous system. Identify that bug, identify that poison, identify that threat in the environment, and adapt to it. That's what the nervous system allows us to do, okay? So, when it's functioning at 100%, we have the highest likelihood of being at that optimal function and that optimal health. That system is so important. It's the only system that we have in our body that's completely encased in our bone. Think about the heart, the lungs, very important. Usually, people, you ask them what's the most important organ in your body, they're going to say my heart, because if my heart stops, I'm dead. Well, technically, not until your brain stops, right? So what tells the heart what to do? Oh yeah, it's the brain. Most people understand that. But again, you got the brain up there, quarter-inch thick skull, completely encasing the brain, and then you've got the brain, the spine here, which protects the brain stem and the spinal cord, and that spinal cord runs down through the spine all the way down to our tail there, and the movable, because if this was just one solid column of bone, we couldn't turn around or look over our shoulder or bend or twist. But it's because we have that disc, and that's the secret here, that disc, which is that pad in between to those bones, absorbs the shock of gravity, but also allows us to move, okay? It allows us to bend and twist. And the thickness of that disc is actually what opens up the hole for that nerve. So when that disc is nice and thick and healthy, we got a lot of space for those nerves to carry their message out to those parts of the body and back to the brain, okay? But these movable parts, they can move out of place on occasion. When it happens in the spine, there's a special name for it. It's called a subluxation. Subluxation, fancy word for a bone's out of place, putting pressure on the nerve. And what the American Board of Neuroradiology found is that a 1 millimeter misalignment in the spine can be enough to interfere with that nerve message being sent, okay? It can be a subluxation, just 1 millimeter of misalignment. And it's because the spinal cord is actually attached. The brain stem and the spinal cord are actually attached to the spine, in the spinal canal there, and they hang loosely suspended by those attachments. So if we torque that a little bit, we create this torsion on the spinal cord, and it'll create pressure on those nerves. And what the University of Colorado showed is that roughly the weight of a dime, about 10 millimeters of mercury pressure on the nervous system, the nervous tissue, can reduce that nerve impulse by up to 60%. So if we've got that pressure, roughly the weight of a dime on one of those nerves, we've only got 40% of those messages now making it out to that part of the body, okay? So if we set up this little scenario here where we've got this subluxation over here, you can see how it's choking off that nerve, that bone is out of place, it's closing down the disc in back, and now it's choking on that nerve, so that information isn't getting out to this organ, in this case it's a kidney. So according to that study, we've got about 40% of those messages making it out to that kidney on day one when this first happens, okay? Now, is this necessarily something that we're going to feel? Maybe not, because what percent of the nervous system is pain sensitive? 1%. So it's like the majority of those nerves are functional. They're carrying messages telling that part of the body what to do and how to do it, when to do it, and then they're getting messages back, sent back up to the brain, and some of those are sensory. Okay, about 10% are sensory, meaning hot or cold, if there's pressure, light pressure, dull, sharp, all of those things are sensory. But 1%, like we said, is called the nociceptors, and those are the receptors that are concerned with pain. Okay? So the point is, we can have something like that going on and not necessarily have pain. And if it's going out to a kidney, for example, maybe the results of that aren't immediately, recognizable. Symptoms of kidney problems. Number one symptom of kidney problems, high blood pressure. Okay, so you go to your doctor, you get your normal